Hello everyone. My name is Baljeet Kaur and this is group presentation for Unit Aboriginal and Torres Strait Islander Health. Today I'm here to talk about health promotion targeting cardiovascular disease in Aboriginal and Torres Strait Islander people in remote area. We have done in a group of 5 people. In my group, Surendra Lama. He has done Aboriginal and Torres Strait Islanders health in remote area and links between culture and Aboriginal and Torres Strait Islander people's health. Then we have Nima hekmat Shoar. He has done health promotion and social determinants of health. Then Baljeet Kaur, and I have done the cardiovascular disease. Then we have Kanchan KC. She has done links between culture and Aboriginal and Torres Strait Islander people's health. Then we have Amarjeet Kaur, and she has done culturally competent and safe care. Aboriginal and Torres Strait Islander health in remote area. Aboriginal and Torres Strait Islander are known to be the first Australians living for at least 6,000 years. The population of Aboriginal and Torres Strait Islander was estimated to be 649,200, which is 91% were Aboriginal background, 5% were Torres Strait Islander, and 4.1% were from both background. The largest population is in New South Wales, which is about 33.3% of total population living in the state. The Australian Bureau of Statistics shows that only 3% of Aboriginal and Torres Strait Islanders were identified to be living in remote areas, whereas about 70% and 27% in urban and regional areas. Here I have the table for population of indigenous and non-indigenous people in different areas. In remote area, the population of Aboriginal and Torres Strait Islander is 21.4%, whereas non-indigenous 1.7%. In regional area, 43.8% population of Aboriginal and Torres Strait Islander, whereas non-indigenous 27%. In urban area, 34.8% population of Aboriginal and Torres Strait Islander, whereas non-indigenous people 71.3%. Aboriginal health is a concept of holistic approach. There is still a huge gap of mortality between the Aboriginal and Torres Strait Islander and the rest of the population. Lack of health service in remote area. Negative stereotypes still exist in Aboriginal and Torres Islander communities. Health improvement of Aboriginal and Torres Islander people is slow and inconsistent. Life expectancy rate is relatively constant. Smoking and use of tobacco causing disease among indigenous people. Cardiovascular disease is the leading cause of high mortality rate among indigenous people. It is important to emphasize on the social and cultural determinants of health and well-being of Aboriginal and Torres Strait Islanders. This is the table for life expectancy at birth. In the year 2005 to 2007, the indigenous male were 67.5, whereas females were 73.1. In 2010 to 2012, the male indigenous were 69.1, whereas females were 73.7. Health promotion. There are many factors that influence health of indigenous Australians. Health issues exist in Aboriginal communities because of biological, social, cultural, socio-economic and environmental factor. Socio-economic status. One factor that influences indigenous health is socio-economic status, which is comprised of 3 factors: employment, education, and income. Indigenous Australians have a lower socioeconomic status than non-Indigenous Australians, which is evident as the Indigenous Australian population is overrepresented as recipients of welfare benefits. Lower income contributes to higher level of health risk factors such as smoking, physical activity, poor diet, and substance abuse, leading to poor health outcomes. Education. Education is associated with higher socioeconomic status and improved health outcomes. People who have access to education and have higher health and literacy rates are more likely to have better health as they get older. According to Ken and Lincoln, Indigenous attendance is lower in remote areas than non-remote areas, and the attendance gap remains larger in remote areas in 2017. Biological. Another vital factor that influences Indigenous Australians' health is the biological, especially when dealing with non-communicable disease. As per previous research has indicated, that type 2 diabetes is more common in ethnic groups like the Australian Aborigines, which is contributed to a modern world epidemic. Cardiovascular disease. According to survey, the census revealed that the highest number of Aboriginal and Torres Strait Islander people living in New South Wales. Compared with non-Indigenous Australians, Aboriginal and Torres Strait Islander people were 70% more likely to die from circulatory disease. And there are many risk factors such as blood pressure, smoking, eating habits, and obesity, which is main cause of heart disease among Aboriginal community. The history of Aboriginal and Torres Strait Islander people and the devastating burden of illness was the barrier for early diagnosis. Because of communication problem, understanding the barriers and access to medical centers were challenged for Aboriginal people. Social determinants of health make huge difference to health outcomes in Aboriginal community, such as connection with their land and colonization. These circumstances has powerful effect on their health, and these factors increase the chances of stress, anxiety, and social isolation. Due to these factors, thousands of Aboriginal people suffered from heart disease like cardiovascular disease, stroke, and traumatization. Links between culture and Aboriginal Torres Strait Islanders' health. Aboriginal people are culturally diverse with culturally differences which lead to unique access issues for health care. They have experienced a lack of cultural understanding within the delivery of health services. Culture and culturally appropriate health care is important and can improve the experiences for Aboriginal people accessing health services to enhance their well-being. Aboriginal and Torres Strait Islander people culture belief about health are spiritually connected with their land. They have strong culture belief that the spirit lives inside the body, therefore gives them life and also heal their soul. The interruption in their culture has resulted ongoing grief, confusion, and left negative impact on psychological, social, spiritual, and affected multiple generations. There is a relationship between Indigenous culture and health outcomes. Australia needs to promote cultural respect through public hospitals to prevent the high incidence of premature and preventable deaths of Indigenous Australians compared to non-Indigenous Australians. For safe practice, cultural awareness can play a valuable role in engaging participants to examine culture for Aboriginal and Torres Strait Islander people. One of the principles for safe practice is holistic approach, recognizing their culture status, based on non-discrimination. Social determinants of health. Social determinants of health include connection to their family, country, and culture, education, employment, income, health choices, government services, housing, and environment. Aboriginal people in remote area have culture, which is love, language, ceremony, kindship, and approaches to health and healing, all of which are expressed through song, dance, art, and storytelling to create and reinforce social cohesion within communities. Aboriginal and Torres Islander people perceive their health from traditional perspective. They believe traditional remedies are more beneficial than other remedies. They even pass their remedies to their next generation. For culturally safe practice, nurses should understand the concept of Aboriginal peoples' culture and impact on their health, and reflect without judgment before, during, and after interacting with people whose culture beliefs, values, and experiences different to your own. As a registered nurse, when nursing Aboriginal and Torres Strait Islander people, open, honest communication and non judgment care is important. Aboriginal people sometimes will not tell the nurses that they do not understand English. In this case, it's nurses' responsibility to think critically and demonstrate culturally competent safe care. According to Queensland Health, they cannot speak English as English is not their first language. They are very hesitant with the use of nonverbal communication and body language. Also, direct eye contact should be avoided by nurses because this is sign of disrespectful, rudeness, and aggression. When undertaking the examination, it is important to take permission from Aboriginal people if the nurses are going to touch them. In order to improve Aboriginal and Torres Islander people's health, staff should know their concept of health, such as cause of illness, treatment, traditional medication, diet, family roles and responsibilities. In healthcare profession, relationship between patients and nurses can be therapeutic because mutual relationship based on trust and respect. According to Rahman, Holmes, and Chartland, nurses should work on three themes, which are organizational culture, caring capacity, and administrative influence. Culturally competent practitioner focused on holistic approach. Procedure and process should be defined clearly to achieve the understanding of patient's treatment. Ask patients about their potential solution and health decision. Now I'm going to talk about conclusion. As we discussed above, Indigenous and Torres Islander people experiencing poorer health than non-Aboriginal. It is very important to understand the history of Aboriginal and Torres Strait Islander people. Nurses should have gained the knowledge being before confronting Aboriginal and Torres Strait Islander people as they are very attached to their culture and belief. Aboriginal people are culturally diverse with culturally differences which lead to unique access issues for healthcare. In order to create better understanding of good health and reducing the risk of developing chronic disease like cardiovascular among Aboriginal and Torres Strait Islander, health promotion done by culturally competent health professionals plays vital role. Opportunity of equal distribution of health access and health infrastructure in remote area can contribute in improving the Aboriginal and Torres Strait Islander people's health. regarding cardiovascular disease. This is the end of the presentation. Thank you.